I'm Dr. Sushila Narayana. I'm a consultant breast surgeon by profession and surgical oncologist also. I have done my DNB in general surgery from Durgabai Deshmukh Hospital, National Board of Examinations, New Delhi. Following which I did my training in breast surgery at the Indo-American Cancer Institute, Hyderabad. After that, I wanted to do super specialty courses in breast surgery because I wanted to bring a new technology into our state to give women the best treatment that is being given all over the world. And in that regard, I went to Italy and I did a fellowship in breast surgery from the University of Ferrara, and I also did a course in breast ultrasound. This was the first time that a surgeon was ever trained in breast ultrasound to do different surgical techniques. After that, I went to United States of America. I went to the University of Chicago and I did a fellowship in breast surgery, and I did an exclusive training in mammary ductoscopy, a technology which I have started for the first time in South India at the Indo-American Cancer Institute. I have also been trained in intraoperative radiotherapy, and I am the first surgeon in India to have performed this technique of intraoperative radiotherapy for breast cancer patients at the Indo-American Cancer Institute. And I am also the only trained lady breast surgeon in our state of Andhra Pradesh, doing breast surgeries and working for the benefit of women. So most of the time when a woman has a lump in her breast, she gets to know that she has this lump only when it becomes of a size of 1 centimeter. Only when a breast lump is 1 centimeter in size can a woman actually try to identify it or feel it on her breast that she has a problem. Most of the time what we've seen is that women, even educated women, are quite unaware about breast lumps, and they really don't know that there is a breast lump growing in them, whether it is a benign breast lump or whether it is a cancerous breast lump. So most of the time they detect this probably just accidentally or while they are having a bath, and then most of them, of course, they do come to the breast surgeon and for a consultation. So 80% of the lumps are not cancerous lumps, they are benign lumps, and about 20% of the lumps are malignant lumps. So once a woman presents or realizes that she has a lump in the breast and she comes to us, so the first thing as a breast surgeon, after doing a thorough clinical examination, we need to first identify what kind of a lump is this. We need to make some kind of a diagnosis, that is cytologically or pathologically, whether it is a benign lump or a malignant lump. So we do advise first a fine needle aspiration cytology as a primary test, just to know what we are exactly dealing with. That is a very simple procedure where you just take a needle and you put it inside the lump and you aspirate a few cells, and the pathologist makes a slide and checks and tells us whether this is a benign lump or a malignant lump. In addition to this, as a first line, we also prefer to do either a bilateral mammography, which is basically called an X-ray of the breast, or a simple ultrasound, a sonomammography of the breasts, to detect first the lump that is there, to also detect whether there are some lumps which we cannot feel to our hand, and also what is the status of the opposite breast. And also through radiological investigations, we do get some kind of a clue depending on the grading, radiological grading, which is called as the BI-RADS grading, which gives us definitely a clue as to what kind of a lump we are dealing with. It definitely aids us in planning our treatment protocol.